A land of immeasurable diversity. A land that offers vast opportunities. This is the nexus of hopes and aspirations from across the archipelago.
Bersama, kami berikan kontribusi nyata lewat inovasi, karya cipta, dan pencapaian lain sesuai bidang ilmu. Dari UI, untuk Indonesia yang toleran, unggul, dan bermartabat.
Welcome to Universitas Indonesia. Since our beginnings, Universitas Indonesia has been continually evolving and building upon our achievements. We have become the biggest, best, and leading university in Indonesia and also Asia. Here at Universitas Indonesia, the best and brightest from across the region come to study. From diverse backgrounds, we build an intellectual community that enriches and enhances humanity. For superior generations, Universitas Indonesia provides world-class learning facilities. We implement state-of-the-art technology for research and industrial development. Our campus is accessible to all, also to the disabled. This is our commitment for realizing an inclusive educational environment. Universitas Indonesia is fully supported by environmentally friendly transportation and sustainable energy systems. We take pride in being a green and sustainable campus. Universitas Indonesia partners with relevant stakeholders to facilitate and provide ease of comfort for day-to-day activities for all our academic community. We recognize that each individual is unique, with unique talents and interests. As such, Universitas Indonesia provides opportunities for every individual to develop themselves to their fullest. Universitas Indonesia provides and fully supports students with great facilities and activities so that students are able to develop and grow to become their best. Together, we embrace our diversity to grow the future together. For Indonesia, for the world. Universitas Indonesia. Unity in diversity. Universitas Indonesia. Veritas, Probitas, Justisia. This is Indonesia, a land of immeasurable diversity, a land that offers vast opportunities. This is the nexus of hopes and aspirations from across the archipelago.
Bersama, kami berikan kontribusi nyata lewat inovasi, karya cipta, dan pencapaian lain sesuai bidang ilmu. Dari UI, untuk Indonesia yang toleran, unggul, dan bermartabat.
Welcome to Universitas Indonesia. Since our beginnings, Universitas Indonesia has been continually evolving and building upon our achievements. We have become the biggest, best, and leading university in Indonesia and also Asia. Here at Universitas Indonesia, the best and brightest from across the region come to study. From diverse backgrounds, we build an intellectual community that enriches and enhances humanity. For superior generations, Universitas Indonesia provides world-class learning facilities. We implement state-of-the-art technology for research and industrial development. Our campus is accessible to all, also to the disabled. This is our commitment for realizing an inclusive educational environment. Universitas Indonesia is fully supported by environmentally friendly transportation and sustainable energy systems. We take pride in being a green and sustainable campus. Universitas Indonesia partners with relevant stakeholders to facilitate and provide ease of comfort for day-to-day activities for all our academic community. We recognize that each individual is unique, with unique talents and interests. As such, Universitas Indonesia provides opportunities for every individual to develop themselves to their fullest. Universitas Indonesia provides and fully supports students with great facilities and activities so that students are able to develop and grow to become their best. Together, we embrace our diversity to grow the future together. For Indonesia, for the world. Universitas Indonesia. Unity in diversity. Universitas Indonesia. Veritas, Probitas, Justisia.
Alright, Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera untuk kita semua. Om Swastiastu, Shalom, Namo Buddhaya, Salam Kebajikan. Good afternoon, everyone. Today is our second webinar, international webinar that was held by the master program of the Faculty of Psychology, Universitas Indonesia. Okay, my name is Jovarian Hudiana, and I am here to serve you all here as the moderator, in which that I will guide the event today here. And I am also an assistant professor in the Faculty of Psychology at the Universitas Indonesia. Today, before we begin our event, I'm gonna present to you some rules that we all need to comply in order for this event to proceed. The first thing that we will need to keep in mind is that you will need to make sure that your internet connection is stable during this event. Second thing is please have decent distance from your PC, laptop, or your mobile device in order for your safety and for your health. The third, please pay attention to the ergonomic comfort of your sitting position during the event. Okay. And the fourth rules is please pay attention to our electrical hazards in the charger cable or switch around you. Okay, so these things are useful for our own safety, yeah. And the last one is please prioritize health during the COVID-19 pandemic, and please, most of all, enjoy the event. With me has attended the speakers. Good afternoon, Dr. Claudia Fernandez Nisa and Dr. Diki Krashover Pelupesi, and also the chair of the Master of Science program, Faculty of Psychology, Universitas Indonesia, Dr. Rizka Halida, or we know her in her nickname as Mbak Ica. And then also all of the audience that attended today's event. Today's event will be begin by the opening speech by Dr. Rizka Halida. And then after that, we will proceed to the event. I'm going to read this curriculum vitae for this Dr. Claudia Fernandez Nisa. And after that, we will proceed to the Q&A session, the first Q&A session. Before Q&A session, of course, there will be, the speech by Claudia. And after that, we will proceed to the Q&A session. After the Q&A session, there will be a photo session for us together. So please do turn on your camera when we are in the photo session. And after we have finished with the photo session, there will be a second speaker, which is Dr. Diki Pelupesi, in which that I will read his CV. And then after that, there will be a speech by Dr. Diki. And after that, we'll proceed to the second Q&A session. What you need to keep in mind is that in the Q&A session, you can ask the questions directly by turning on your video and your microphone, or you can also ask via chat box. Okay, so you can use both means in order to ask questions. And please keep in mind that if the questions, if you ask. If you are regarded as the one who asked the best questions, then you will win perhaps one of the prize that we will give at the end of our webinar. Okay, just like the previous webinar. Okay, so without further ado, I'm gonna let the stage to be filled by Dr. Rizka Halida, the head of the Master of Science, Faculty of Psychology, Universitas Indonesia. Mbak Ica, the stage is yours.
Okay. Thank you, Mas Jo. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera untuk kita semua. Hello to all participants. Welcome to our webinar. Today we will discuss about topic that has been our concern for about 2 years. It's about COVID-19. And today we will see it from the perspective of human behavior. We will discuss about perceived risk of economic and health, which one has more impact on people's compliance to health protocol in 24 countries, including Indonesia, and how Indonesia's effort to fight the pandemic from the behavioral perspective. Our understanding on this issue will certainly be helpful for us and for policymakers in designing prevention measures program. Here in our Master of Science program, Faculty of Psychology, Universitas Indonesia, we are committed to develop our understanding of human behavior through research, collaboration with scholars from different parts of the world, and disseminate research to our students and the public. We aim to improve our scientific knowledge and theories about human behavior in order to answer the problems in real-life context. Our event today is one way to show our commitment and to achieve our aim. We are keen to learn from our speakers today about the human behavior aspect of prevention measure of COVID-19. Here with us today, we have our two speakers to share their research and experience. First, Dr. Claudia F. Nisa from the Dukunshan University and NYU Abu Dhabi. She is a member of Psychorona study. And our second speaker is Dr. Diki Pelupesi. He is the head of Crisis and Social Intervention Lab in our faculty. He is actively participating as social expert panel of COVID-19 task force. My special thanks to our speakers today, Dr. Claudia and Dr. Diki. Thank you for your willingness to be here today with us. I also thank the Dean of Faculty of Psychology, Universitas Indonesia for her support in conducting this event. I thank also to Dr. Jovarian Hudiana, who are acting as our moderator today. He is also part of the team of Psychorona with Dr. Claudia. And I hope this seminar brings more understanding, triggers more discussions and actions about prevention measures on COVID-19 pandemic. Thank you.
Thank you, Dr. Rizka Halida, Mbak Icha, for that warm welcome. Okay, so without further ado, let's just proceed to our main event. And I'm gonna read to you all the curriculum vitae for our first speaker, Dr. Claudia Fernandez Nisa. Mbak Medi, if you would, can you please show the CV? All right. So this is the curriculum vitae for Dr. Claudia F. Nisa. So she is currently a research scientist in the New York University, Abu Dhabi, United Arab Emirates. But we congratulate her for that. She has received a tenure position in as the assistant professor of behavioral science at the Dukunshan University in China. And her research focus is on the public health and sustainability, health and environmental psychology, meta-analysis, climate change and conservation, sustainable development. And her specializations is in the intervention science and implementation science, evidence-based practice, and randomized field trials, and also lab experiments. She has also received some grants, in which one of them is from the National Research Foundation Singapore, with the title of the project is Short and Long-Term Impact of Social Comparison Effects to Promote Sustainability and Resiliency. So when I see your CV, there are a lot of research regarding climate change and sustainable behavior. So that's her expert. And her most recent publications in the proceeding of the National Academy of Science is this Secure Human Attachment Can Promote Support for Climate Change Mitigation. So apparently climate change mitigation is a function of the attachment style for the individuals. And also what she will talk about today is her next paper, which is published in Nature Scientific Reports, which is the Lives versus Livelihoods Perceived Economic Risk has a stronger association with support for COVID-19 preventive measures than perceived health risk. So she's a part of a Psychorona team in which that there are a total of 100 scientists from psychology from all around the world. And this team has collected the data from these last 2 years regarding the development of the COVID-19 and the behavior of the people. So I'm not gonna explain more about this. I'm sure Claudia will explain to us a lot more about this in her session. Okay, so let's invite Claudia. So Claudia, the stage is yours.
Hello, everybody. I am extremely happy to be here. I have to say, it's my pleasure and my honor to have been invited. It's my first time on YouTube ever, so I'm very excited about this. Thank you all for coming, and please feel free to ask whatever questions you think are important to you. So I am just a little bit background on me. So I am originally trained as a psychologist, as a social psychologist. I did my bachelor degree in social psychology, but over time, I felt that psychology was not as applied as I would like. So, a couple of decades ago, psychology was much more, let's say, dedicated and interest in real life issues, like racism, like, poverty, like, things that are really strong social issues. And over time, psychology became more and more interested about, just theory development, and making contributions that are more conceptual. So I end up, doing my graduate studies more towards policy, because I'm very interested in how psychology, and our psychological theories can really help us tackle important social issues. So that is one of the reasons why, when I was faced with the COVID pandemic, I saw this issue about, the health and economic problem being, so debated, but I didn't see that so much in the literature, right? So this is really the motivation behind the work that I'll be talking to you today. So let me share my screen here with you. Just give me a hands up. Can you see the screen okay and hear me okay?
Yes, we can see the screen.
Perfect. Okay, so what I'm going to be talking to you today is, the title is very similar to the title of the seminar, which was the title of the paper that I will be talking to you about, which is whether perceived economic risk is more or less important than perceived health risk when it comes to complying with measures, with COVID prevention measures. So let me see if this works. Okay, so the paper has been published in Scientific Reports, as Dr. Joe said, and this is part of a larger international collaboration that is, I would say, probably the leaders are NYU Abu Dhabi and the University of Groningen in the Netherlands, who really put the partnership together. So I don't know if you've seen, probably in Indonesia, this also happened, but all across the world, there's been a lot of headlines about this, this debate. Is it, should we save lives or save the economy? And there's a lot of opinions about this, a lot of commentary views about this. Some people saying, yeah, no, we should save lives. And on average, there was a certain agreement, mostly in the beginning, that, the important thing is to save lives and let's forget about the economy. These views sort of changed over time, and some people start to be really, against the measures because they thought that it was harming the economy so much. But most of it has been about opinions, about, points of view, about people discussing perspectives, right? And we, as members of the academy, at the university, have a sort of responsibility to bring some data into these debates. So let me just talk a little bit about the background here. It's something that is very interesting for me, because this graph represents extreme poverty over time, right? And you see that, the world on average is getting better. So, poverty rates are coming down, and the expectation is that, they will be going down, down, down. And then with the pandemics, there was a big surge, right? You see that the pandemic really increased the levels of extreme poverty around the world. So the difference between what was expected for 2020 versus what happened is 100 million. So basically the pandemic put 100 million people on extreme poverty, right? And I feel that this is something that maybe is not debated enough, that a lot of the discussion is about, people getting scared to be sick. And I will debate a bit why I think that happened. So in terms of for 2020, what is estimated, not so much what's reported, because not all COVID deaths are reported. There's a certain confusion, but why, if certain deaths were caused by COVID or not. But in terms of estimates, it is estimated that COVID was the third most prominent cause of death during 2020, okay? Okay, this in itself, it's serious, right? But if you think about it, more people die from heart disease. Why isn't heart disease as publicized as COVID, right? Why? There are several reasons. First, heart disease is not a contagious disease, right? So it's a chronic disease. People don't spread it around, right? So that is one of the reasons why COVID became so important, because it's it's a communicable disease. That means it's spread human to human. But my view is also that COVID became such a big issue because it became the first or second cause of death on what we call the developed world, okay, the wealthier world. So we're talking about, America, including North America, and we're talking about the European region, right? But if you think about it, for Africa and your own part of the world, COVID is still not top 3, okay? So that means that, if there is some weird bug developing in Africa and kills thousands of people, people in Europe and North America, for them it's just a sad story. But when it comes to their doorstep, then things, people start to get a bit more scared. So I believe that's one of the reasons why the health risk, the probability of getting sick was so highly publicized, was given so much attention. Whereas people in poorer countries with less developed economies, they suffered with this duality. Okay, maybe if I get COVID, if I don't die, it's not as bad as long as I can feed my family and keep my job. Okay, so this again is the reason behind why I thought about this paper. So there is some data about what people think, should be more important. And during 2020, so you see for across the world, people tend on average to agree, that saving lives is more important than saving the economy, okay? But the bottom line that we're gonna talk about, what really matters, okay? What seems to be more important when it comes to really predicting how people behave if they follow the measures, the preventive health measures or not. So what is in fact more important? So this was the research goal with this paper, which is, measuring these two things. So how much people think they're at risk economically, how much people think they're at risk in terms of health. This was measured with an item, how likely is it that in the next few months, your personal situation would get worse due to economic consequences of the coronavirus, okay? And health was measured as how likely is that in the next few months, you'll get infected with the coronavirus. And I analyzed how this was associated with things like preventive health behaviors, which is things like how often people wash their hands, if they avoid crowds or not, and if they're actually willing to, isolate from others to prevent the spread of the virus. And also things like support for some policies, including should people be, should be mandatory for people to get vaccinated. That means, is it people are forced into a vaccination? Whether it's mandatory quarantine for people who are suspected to have the virus, and whether in a very extreme cases, you should actually report to the government whether you think somebody has COVID and that the person should go into quarantine. So this is the main research goal of the paper. So let me show you some results. This was collected in 24 countries with national representative samples. So we have about 25,000 people in the study. And this is some of the data for Indonesia. So we had 954 people from Indonesia. You see the age, a pretty young sample. So almost 90% are below 54. And one interesting thing here is that financial insecurity. So we measured also how people feel in terms of financial insecurity. And we measured this in how you think the difficulty they perceived of paying their bills. And almost 50% of the sample said, that they felt difficulties paying their bill. See, let's say here compared to Japan, or the Netherlands, this is a very different number, right? So we already suspect that this issue of in Indonesia is an important one of how much people perceive to be at risk economically. And across the world, what we see is that, it's not just Indonesia. So across the world, people do perceive that they think there's a higher risk for them to suffer economically than there is a higher risk for them to get COVID, okay? And I do feel that this is something that has been sort of unnoticed, that has been sort of unreported, that there's a lot of news and a lot of buzz about, the virus, but in fact, people perceive their risk of suffering, losing their jobs or not having enough money to pay their bills or to pay for food people perceive this as a higher risk. And this is across the world. Okay, this maybe it's easier to see here. This graph shows the difference. So it's one risk minus the other. So health risk minus economic risk. And you see that, if it goes on to the left side, that means that all countries perceive health risk to be a higher risk, perceive to be economic risk to be a higher risk than health risk, and more so in some countries. And Indonesia is pretty high on this list. Okay, so you see countries that, more robust economies, the higher GDPs, they think for them the economic risk is closer to the health risk, but still economic risk is higher. Okay, 0 here would mean that they perceive health risk and economic risk to be the same. Everything that goes on this side means that health risk is smaller than economic risk, and by different magnitudes. So, countries up here perceive the risk of suffering from the economy much, much higher than suffering from health and economy. And Indonesia is one of these cases. And then I did an analysis, for a bunch of, does this apply to, this fear and this perceived risk of suffering more economically than health? Is it, something you can find across different social groups? And it's true. Whether you look at age differences or gender or education, or this is a proxy for income, or employment status, or political ideology, without exception, everybody perceives economic risk to be a bigger problem than health risk. So obviously, you see here, young people, they perceive the risk of getting COVID less than older people. But regardless, everybody perceives economic risk as a higher probable risk than the risk of getting COVID. Then, so we want to compare this, how these risks compare and relate or are associated with behaviors. And we measured these preventive health behaviors and policies, right? And this is the percentage of people that agree or agree strongly with these things being needed. And Indonesia has really a high agreement rates for the need to wash your hands, the need to avoid crowds. Not so much for social isolation, but this is a pattern across the world. There's a lot of countries that are pretty much against social isolation. So you see some countries are a bit higher, but there's also China. You also have here very high Romania. So the countries where COVID at the time, this was March, April 2020. So when at the time COVID was booming in some countries, they were in favor of social isolation. Indonesia here had a pretty low agreement about social isolation at the time. And also pretty reasonable to high support for policies that are restrictive, like imposing vaccination, imposing quarantine, and reporting cases. But the bottom line is, how do these risks predict or are associated with these behaviors? So now we go to some strong data. Let's see if you can see this properly. So we did models. So when you have individual data being compared with country data, you use this thing called multi-level analysis, which examines how individual data may be influenced by country level data. So we had a questionnaire with a lot of variables, of which I used primarily this risk. So perceived economic risk, perceived health risk, and also how these things interacted, which usually we do by multiplying these things. Okay, so how these things are working together. And we controlled for many, many, many things at the country level. Let me just give you some examples here. Total population of the country, gross domestic product means GDP per capita, unemployment rates, how old is the population, a measure, Gini index, which is a measure of inequality, income inequality. We have how much the country spends on health, on private health, how much people have to pay out of their pockets, number of hospital beds. So we controlled how these individual views across the world may be shaped also by these countries, by country characteristics, and controlling for all that. So controlling for all the differences in the countries worldwide, what we see is that economic risk is reliably the strongest predictor of how people behave, whether they comply with measures or not. So let's see, here health risk is not significantly associated with any of these behaviors, neither washing hands, avoiding crowds, or social isolation, whereas economic risk is statistically associated with all of these measures. Okay? Then we have some interactions here. What do these interactions mean? So I wanted to look at interactions because this is a way of putting into statistics the debate of whether people consider this health and the economy to be against each other or not. So that means that when you have an interaction and the interaction is positive, okay, that means that, you know, the higher people perceive economic risk and health risk, the more they comply. If the interaction is negative, that means that if I perceive a very high economic risk, I actually don't want to do any of the measures. I don't want to wear masks. I don't want to avoid. So the interaction would be negative. This case here, it shows negative for social isolation, which is, that means that it was by far the most complicated issue of the pandemic was social isolation. So people don't have a bit of a problem with, you know, washing hands or avoiding crowds or not even masks, but staying at home and not interacting with others produces some weird effects. That means that, you know, the more people perceive to be at higher risk, you know, the less they wanted to stay at home and isolate, and they didn't care so much about, you know, whether the economy was doing. So I think that one of the key things we noticed about the results is that people are okay with certain measures of containment, mostly, you know, washing hands, masks, and avoiding crowds, but staying at home without talking to anybody, that was a bit of an issue. So a very similar pattern happened here. So economic risk predicted support for any of these measures, even though health risk, one of the things that perceived health risk predicted the best was vaccination. So the more people think that they are at a very high risk of getting the virus, the more they supported that everybody should be, you know, forced to be vaccinated. That was one of the few exemptions that health risk work well, but otherwise, the feeling that you are at risk economically is really what predicted support for a number of these measures. Anyone, I don't see hands. If anyone wants to interrupt, let me know. Okay, or you can ask anything you want in the end, okay?
May I?
Sure, go ahead.
Thank you, Claudia. I just want to clarify this thing, your study, and your research. Is there a study of the correlation between talking about economic risk and health risk versus the level of education and religions, for instance? As we know, I think it's not surprising that the one that is in poverty or let's say the have-not will be very economic risk is greater. That is not surprising, because they rather than suffering from economic poverty, if you are dead, it's okay, rather than living in poverty. Okay, so but your study is there a correlation with regard to the religions as well as the level of education? Yeah.
So let me see if I'm going to try to see if I remember everything you asked. As far as I remember, and Joe can help me here, I don't think we measured religious preferences in our survey. Okay. I think. Did Joe? I don't think we did that.
Yeah, we did not really ask that as a demographic data. We only asked that as a, you know, a construct, a psychological construct.
Yes, so I cannot provide any information for you on that. When it comes to education, let me go back to the slide. So you see that I'm going through your question. So, so you see there's hardly even people from primary, secondary education up to higher levels. You know, the pattern is pretty standard. So for all of them, they perceived economic risk to be higher than health risk. Yeah. Okay. And here, in terms of financial insecurity, going to your point. So let me say, it is so rather obvious that the poorest will feel that they are at a greater economic risk, right?
Yeah,
So that is
yeah.
pretty obvious.
Yeah.
What is not so obvious is that is the thing that is driving whether people comply with the measures or not. You see, so you could still think that I am at really great economic risk, but it could be my fear of catching the virus that will lead me to comply with the measures. You see, so the interesting thing is not so much that, so you see here, right? So the people at low financial insecurity, okay, so people better well off, the perceived economic risk is still a little bit higher. Obviously, the ones with high financial insecurity, the poor people, they feel that they are a much higher risk of getting, you know, economic problems here. But the thing is that
what about compliance?
Sorry?
But what about compliance? Does
that's
the
the
lower
thing.
education, for instance, or the poor people tend to not comply with the prokes, you know,
I see your point. So what you were asking me is about like the main effect of education. How is that influencing compliance? Is that it?
Yeah, yeah.
Okay. I have to go back to my, because that was not the key issue of the paper, but I can tell you that almost for sure, and I can confirm that in the paper. You can see that in the paper. Is there in supplementary information? I believe there was no effect. I believe education had no effect, as far as I recall. So there is, you know, it is an interesting thing because education is usually considered to be such, and education is a huge thing. But when you look how much education really influences behavior, is usually less than you would expect. So sometimes we think that, you know, more highly educated people are just, you know, so enlightened, and, you know, and they do everything right. It is not exactly true, you know, and as far as I remember, and I can check the paper after, and you can also take a look, but I think it was education played no role in this.
No, sorry, before Wahyu. What I'm saying is there is a tendencies of the lower economic or level of economic or education tend to not comply. Is that a hypothetical?
Not so as I said, according to our data, I don't think that is a right assumption. I don't think so.
Okay.
So that doesn't mean what it means that I think everybody maybe complies very little, you know, the poor and the rich, the low educated and the high educated. So I don't think that education plays a big role there.
Yeah, Claudia, I can actually confirm to that. I just read your paper again, and yeah, you mentioned in the paper that actually the effect persists regardless of the age, gender, education, employment, and financial status. So in the model, the education is not really does not really have any effect. Okay, so that's about it. I hope that answer Pak Ibnu. I'm sorry, for Pak Wahyu. May we? Claudia, may we, move the Q&A session after your talk? And if that's okay with you, but you are welcome to, answer the question now. It's up to you.
Sure.
It's a short question.
Yeah, I think it's okay. Why you please do so?
Oh, sorry, it's short, so it won't matter.
So please
my question has to do with the how it all ties in with what regulations or what policy the government implements, because 24 countries, totally different policies and so on. So did your study take into account this fact? Because perceptions are formed by what reality is, like what sort of regulation is in place and so on. Some countries immediately impose a lockdown. Indonesia chose not to. The effects have been different. So maybe you can give us some light about that issue. Secondly, on the question of compliance, as Pak Effendi mentioned before, I can see that the factor of education may not have any influence on how a person behaves or complies. I would like to point out that in the United States, the U.S. Congress has a mask mandate, whereas the US Senate does not. Now, these are all highly educated people. Maybe you can explain why the behavior of the Americans are so interesting. Half of the population think that, and they're all Trump supporters, think that all this epidemic is a democratic tool to unseat Donald Trump. That's the second part of the short question. Thank you.
Okay, I forgot the first part.
How regulations, government regulations.
Okay, I remember.
Play a role, yeah.
Okay, I remember. Okay, so to be quite honest, and I think it's a limitation with psychology, and even I who try to be more applied. Often we do studies that we find are interesting and relevant. Whether we can make very clear recommendations from what we study is a different question. So I do think that, and even we are part of an international project. You ask me, do I think any of the papers we produced can give clear guidelines to the government? And my answer is clearly no. Even though I think I try to do that as much as I can. And as you see, like in the final slides, my only recommendation to any government would be highlight that the messaging to the people should be, if you don't want to lose your job and if you don't want to lose any more money, follow the recommendations, follow the health guidelines. Whether countries that have different macro policies like lockdowns would have an impact, I cannot tell you. The only thing I can tell you from my results is that social isolation, so which is a sort of lockdown, right? People do not respond well to that. Okay, even though we know from an epidemiology perspective that that is the right thing to do. So to be honest, and I have some people speculate from their results, I try to be, rigorous about the things that I can say. Unfortunately, for macro level policies, whether you should do lockdown or not, I cannot tell you. I cannot tell you that, I have no idea. What I can tell you is that in a case of no lockdown, or in a case where people go about their lives, the best message for them is, do the right thing. Otherwise, you're going to lose your job. Otherwise we're going to, there's not going to be any employment. You may starve. You may not be able to feed your family or pay your bills. Okay, that seems to work better than tell people, wear a mask because you may get sick. Okay, so that is as the extent to what I can say, because our models, they controlled for a lot of macroeconomic variables, but I did not control for the fact of whether the country, had imposed lockdown from the beginning or not. So this sort of, policy specific COVID things, I did not control for, which I do think it's a limitation of my work, because I do think that these international collaborations, they should combine the brains across the world to answer questions that are important to be answered. And I do not think we did a very good job at that, in all honesty. Joe, I'm sorry to say that. I said that to my own people here. I say,
no, that actually represents your humility, actually.
No, because,
as a scientist, I mean.
Because, I think a problem in psychology, and I began to say that, is that, if pre-pandemic people were working on attitudes or were working on, I don't know, values or whatever, right? So whatever they were working pre-pandemic, that's what they wanted to study during the pandemic, right? So they wanted to collect data for their own research purposes. Whereas other, important questions like, what is the best message to get people to wear masks? What is the best message to get people vaccinated? I don't think we were able to fully answer these things, which I think it's a real shame. That's one of my views about, the social science approach to the pandemic. Whereas the biologists and the doctors, they knew what their goal was. We need to get a vaccine as soon as possible. I think we in the social sciences also need this sort of approach. So what should we tell the government? What should be done? And we don't know exactly. That is as much as I can tell you.
Okay.
So I'm almost done. So this is just, again, these graphs just to show you that what is the relationship between health risk and economic risk, right? When this is graphs that explore interactions. If these things were if in people's minds, these risks were conflicting or opposing, you would see the lines crossing, right? You would see that the more people perceive to be at higher health risk, the less they would comply if they thought that, this was harming the economy. So the only thing these graphs tell you is that, in people's minds, saving their lives and saving the economy are things that go together. And they are more concerned about economic risk, but it's in fact their perceived economic risk that is driving how much they comply with the measures or not. And less so the fact if they think they're going to get COVID. And that is not only for Indonesia, that is across the world, even for people who are not poor. Even for the less poor, we see this pattern repeated across the world. Okay, so I'm summing up. So key takeaways, again, as much as I can say reliably from the data that we have. So global risk perceptions are not as high as people. Sometimes, we watch the media 24 hours a day, they talk about the statistics, and actually people, they don't perceive the risks to be super high. Okay, they perceive the risks sort of low to moderate, but they perceive economic risk higher than a health risk. And this is across all ages, all educational levels, all levels of financial security or income. Okay, this is a pretty reliable result. And then no effect from this case fatality rates are those statistics from public health. How many people died today? How many cases we had? So these sort of things, it doesn't seem to have any impact at all in whether people are complying with the measures. And to your point, to the participant's previous point, differences per country don't seem to be playing a big role. Okay, so whether your country has a pretty robust health system or has higher GDP or has a lower unemployment rate, it doesn't seem to be affecting as much. So everybody across the world really thinks that the biggest risk is economic, and not only that, that is driving their compliance. Okay, so as I was saying, so the only thing that I can reliably say is that if you're going to put some measure out there, tell people, do the right thing, otherwise you risk losing your job, we risk going into poverty, and we risk not being able to pay bills and buy food. So that seems to be, it's probably a better option than telling people, do the right thing, otherwise you may get sick or your family may get sick or you may die. So, and that is again apparently across all the countries that we examined, but highly so in Indonesia, China, and South Africa. So it was the top three. And that is it. Thank you so much.
Okay, so thank you, Claudia. Let's give a round of applause to Claudia, online round of applause, because we cannot really hear your clap. So let's give her an applause within the Zoom app by using the emoticon reactions. Okay, so very interesting. Thank you so much, Claudia, for your presentation. So what we can summarize from Claudia's presentation is that in the case of pandemic, which has actually going on for about 2 years now, economic issues and how economy is compared to health as as a factor which may affect how people do some prevention measures of COVID-19 has received lots of headlines. And while people tend to agree that we should save lives in the pandemic settings, apparently the data from that was found by the Corona team led by Claudia actually found that across the world there is a higher perceived economic risk compared to the health risk, and this perceived economic risk has actually affected several outcomes more reliably compared to the health risk, perception of health risk. The outcomes such as hand washing to avoid crowds, social inclusion, mandatory vaccination, mandatory quarantine, and reporting for the suspected cases is actually more consistent when we consider the perceived economic risk as the predictor compared to the perceived health risk. Okay, so the key takeaways is that like what Claudia has already presented to us, is that please follow the recommendations to avoid economic losses if you want to tell the people, okay, not the health risk, but the economic losses. Okay, apparently that is more effective in making people to comply compared to, you know, maybe for like you should follow the regulations of social distancing because it will you know, save your life, save your health or something. That is less effective compared to when we ask people to please comply the social isolation measures in order for you to avoid your poverty, for example. So yeah, that is really, I think that is really interesting and really insightful for today's presentation. Okay, so I'm gonna invite, we already have two questions there from Dr. Andes Muhammad Ibnu and Pak Wahyu Indrasto. So thank you for your questions. And now we have another question from...
Is it in the chat?
Yeah, it's in the chat. I'm gonna look for the chat first. Okay, from Angelea Putri Aisyah. Okay, so Angel asked, it's really interesting how even with the amount of debt coming from COVID-19, a lot of people, especially the poor society, still fear economic risk more than health or a possibility of death, which death itself should be salient in humans' mind. I'm wondering what's the possible contributor towards this trend. She agreed with Pak Ibnu that people might be more afraid of that from poverty rather than this pandemic. So the question is about the death and how death is being represented in our minds. I think that's her question about. Claudia, could you answer that?
Well, I don't know a lot about how that is represented in people's minds. That is not my area of expertise. But you can look, I guess, for papers that, you know, are about things like called terror management theory to see how people, you know, dealt with that. But the fact is that I think people are more perceptive than sometimes we think, because in reality, and looking at the statistics and even from World Health Organizations, they always said that the probability that somebody would get the virus is not very high. Okay, that is the reality. So the problem is that infectious diseases, they bring this scared, you know, that people, you know, if I touch somebody, I will get them. So, but the reality is, and you know, and the statistics that I saw initially, there's a lot of more people dying from cancer and you know, and heart disease and a bunch of other stuff, probably even car accidents, than from COVID. Okay, the fact that in infectious diseases, they bring this, you know, red alert in people's minds. But the actual statistics is that, I don't know exactly, but it's about, you know, the likelihood of getting COVID is maybe like, oh, I don't know, 1%, and the likelihood of dying is maybe 0.1%. I don't know, these are made up numbers, but I know they are small, okay? So that means that maybe people realize that, and, you know, and it's much more tangible, the fact that, you know, maybe in a couple of weeks, I cannot pay my bills. Or, you know, I may not have money to, you know, to buy food. So that is my, you know, speculation. That's all I can, it's not really, it's my own opinion. So let's be clear that it's my view on this. Even though I remember that I read some news clips from India, and where people clearly stated, we're more scared of starving than of COVID. And that was like people's direct quote. So, and as I said in the beginning, I think this issue is more salient in people's minds that come from poorer countries. Whereas most researchers are, you know, in their offices, in their cozy chairs, you know, and the worst thing that's going to happen to them is that they cannot go out for dinner. They have to stay home, order Chinese and watch Netflix, you know. So the health risk is more salient in their minds. Whereas, you know, for a million other people is the economic risk that is more salient. That is my small view on this.
Okay. Yeah, I think that answers your question, Angelia, or maybe do you have any more questions? Because I noticed that you wrote another question in the next chat. Maybe you can use microphone to explain more about your question, or maybe your response to the question, to the answer by Claudia.
Yeah, thank you, Mas Chu, for maybe I'll ask from audio. What I was thinking is that maybe it is true that maybe some people are more of it's not that they're afraid of death, but they perceive that COVID-19 is not as certain as death. Like what Irsal said in the chat, that it's not that people doesn't afraid is not afraid to die, but it's because people feel that poverty is more certain as probably a probable cause of death rather than COVID-19. And uh, I think that reporting, this has something to do with reporting the recovery rate and how we say that it's not that a dangerous virus, but because it's really apa ya, mudah banget untuk it can transfer easily to other people. uh, it makes us downplay COVID-19 because of we see it as it's not that important, it's not that deadly rather than economic. So we tend to downplay COVID-19. What I was wondering too is, does your research see how or have any findings about how people perceive COVID-19 virus itself? Because I think that uh, how we believe COVID-19 virus, is it deadly? Is it just some kind of flu? Is it a deadly virus? It has something to do with how we perceive the risk that it's making the world.
Okay, thank you. First, just start by the beginning. What the comment that Irsal wrote is absolutely right. I 100% agree. So it's not because people are not afraid to die, it's because poverty is more imminent. That is exactly right. So I guess the whole point with this paper is that if you look at the news worldwide, and if you look at the scientific research coming out, our project included, if you look at most of the papers coming out of our project, the risk they talk about is health risk, okay? And again, I come to the point that is, these are mostly scientists coming from developed countries for which, there was never a risk of losing their jobs. There was never a risk of losing their income. So most of the academic research being published worldwide about COVID really focuses on health risk for these reasons, because the economic risk is not so salient in their minds. But what the work I showed you shows is that regardless of this, even people that are comfortable financially, they still perceive the economic risk. It is the perceived economic risk that is driving whether they comply or not, okay? So even for people who are well off. About your question about how people perceived, I cannot speak to that. Unfortunately, I have personally done no research about it. And I don't think even our project did anything about how people perceived the virus in terms of being lethal or not. What I can tell you is that I looked at some data related to political ideology, particularly in the US. And so you have this thing, as you were saying before, that, people think like, in the US, they are a bit crazy, and they think that like the virus was made up by Democrats or whatever, right? And the Republicans are against it. They are against using masks. They're against vaccines. But the thing is, when you look at the data, whether you're liberal or conservative, everybody perceives economic risk to be higher, and everybody perceives is economic risk that is driving their compliance. Okay, so whether people think it's just the flu or not, maybe people think it's the flu and some other think it's a serious thing. But regardless, perceived economic risk is driving people's responses to, whether they comply or not. So I'm not sure if people thinking it's a flu or not, it only brings back to the point that, however people perceive the health risk, either higher or lower, that is not really what's driving behavior. It's really how much people perceive to be potentially threatening to the economy and their own economy.
Okay, thank you, Claudia. And yeah, the point by Irsal is really interesting. Thank you, Irsal. And so I'm gonna invite for one last question, if there is any question. I'm just gonna actually also answer that one of you has asked whether the material can be accessed, when will be sent via email. Well, actually, for those who would like to ask the same, the materials is freely accessible via YouTube. Yeah. So after this, you can access YouTube of the Faculty of Psychology, Universitas Indonesia, and then you can access the recording and the materials there. Okay.
And also the paper is free online.
Yes.
We paid for it, so it's completely free if you want to look at the original paper.
Yep. It's free in the Nature Scientific Reports. Yeah. Okay. Okay. Daniel Ariwibowo has another question for you. He said, "Thank you for your presentation, Dr. Claudia. I have a question for you. Can the awareness of economic perceived risk be raised and implemented by government through an authoritarian approach, such as enforcing vaccination certificate or participation as a requirement to enter all economic centers, such as marketplace?" Oh, this is interesting question, like an authoritarian approach. Okay, so how would you respond to that?
Well, whether an authoritarian approach would increase the awareness, I'm not sure. Usually authoritarian approaches really change behavior, which can be a good thing. Okay, so sometimes in situations of crisis, a democracy takes longer to act. And I'm here in the United Arab Emirates. Okay, I would say this can be considered an enlightened or an autocracy of sorts, and they did an excellent job. There's no, the regulations were clear. There were fines during lockdown, severe fines if you were on the street, so the approach was very, cut across. So that changes behavior, that I can tell you. Whether that changes awareness about risks, that is a different question, right? So sometimes the attitudes and beliefs, and they're not the same as behavior. And usually in times of emergency, what you want is to change behavior, not so much how people think. So the only thing I can say is that, and it's not that I'm pro-autocracy or against democracy. Let's be clear about that. What I'm saying is that in cases of crisis, an autocracy may be more efficient into changing behavior, okay, into enacting behavioral change, okay, than democracies who sometimes don't have the same mechanisms to enforce behavioral change. So that is the only thing I can say. I cannot say that is going to change people's minds. That is definitely going to change people's behaviors. That is what I can tell you.
Okay, so thank you for your answer, Claudia, and thank you for the last question, Daniel. So that's our first session for today. Thank you so much again, Claudia, for your insightful presentation. And let's give another round of online applause to Claudia. Okay, and thank you for your for coming to this event and give such an interesting talk. Okay, so now we proceed to our second agenda, in which that we will invite Dr. Diki Christopher Pelupesi.
Mas Jo, sorry, kita sesi foto dulu.
Yes, okay, thank you, Mbak Hani, which I usually call him as Mas Diki. But before we begin, just like Mbak Rani has told us, we will take a group picture. So please turn on your camera, all of you, and make sure that you are in the best position and in the best light. Okay, so yeah, please turn on all of your camera and we will take a picture. All right, Mbak Rani, I'm gonna welcome you to lead the photo session.
Thank you, Mas Jo. Greetings, ladies and gentlemen. I'm Rani. I will get the photo session for today. Ladies and gentlemen, please open your camera. I will start to take the picture. 1, 2, 3. For the next picture. 1, 2, 3. Thank you. The photo session was over, and I will return the session to Mas Jo.
Okay, thank you, Mbak Rani. Okay, yeah, so we will invite Dr. Diki Christopher Pelupesi, or I usually call him as Mas Diki. And I'm gonna read his CV first. Mbak Medi, can you please show us the curriculum vitae for Mas Diki? All right, so yeah. All right. So yeah, Mas Diki is an assistant professor and chair in the Laboratory of Crisis and Social Intervention, Faculty of Psychology, Universitas Indonesia. His research focus is about social intervention, community empowerment, COVID-19 prevention measures, and disaster response and disaster prevention. Yeah, Mas. Yeah, I know Mas Diki as someone who really cares about social issue and someone who is, really care about the applications of the social psychology. And Mas Diki has also several external positions. Right now, he's a social experts panel for the Indonesia's COVID-19 task force. And he's also the remote UN family therapy implementation science study in Indonesia as expert. And then he is also a senior research associate for the child protection in emergencies. And his most recent publications is about mental well-being following landslides and residential displacement in Indonesia, and also environmental displacement and mental well-being in Banjarnegara, Indonesia. So a lot of his research actually deals with the impact of displacement, yeah, Mas Diki. Yeah. Okay, so without further ado, I'm gonna invite Mas Diki on stage. Mas Diki, the stage is yours.
Okay, thank you, Joe, for the warm and nice introduction. And most of all, thank you for the organizer for inviting me, for having me to be here to present one of the studies that I conducted in the past 2 years, and it's really a great privilege that I present my research, my study together with Claudia's research. And when I got the invitation from the organizer, I was like need to be silent for a minute because I need to think which studies that I need to present, and then because I need to also to have a look what Claudia would present at that time. So then then I choose one particular study that I hope that it will give us all of here to be to have a kind of a convergence understanding, because Claudia's presentation, it was about risk perception, risk health perception and risk economic perception. So then I chose one of my studies that is talking something about risk also. So yeah, I hope my presentation can expand or can also provide more understanding. Then I would like to invite a robust discussion, Q&A afterwards, after my presentation. Then I hope that my presentation can be related to Claudia's presentation in the end. Okay, let me share screen. Joe, can you please let me know how long do I have time for my presentation?
You have 30 minutes, Mas Diki.
30 minutes. Okay, thank you. That's more than enough because I have only 11 slides. So yes, then I will, I invite all of you to have discussion, and not just discussing my presentation, but also to relate it to Claudia's presentation before. So this is really something that I think in the last question to Claudia from Daniel, he mentioned about market. So here it is, my presentation or my study that me and my colleagues, my team conducted almost 1.5 years ago. So it's quite old study. Unlike the way Claudia formed or set up her research, because during Q&A, Claudia mentioned about, it's not really about advocating a policy, right? I mean, the way, we need to read the result of Claudia's presentation. Unlike what Claudia did, when I conducted this research was actually really in the beginning of the preparation. That's because of a government policy that was going to be taken at that time. And okay, let me explain. Let me tell you what happened at that time. So in June, around June or end of May last year, in Jakarta in particular, the capital of Indonesia, we were facing and we were experiencing so-called, market cluster, cluster of transmission, happen in the markets. That's what happened at that time. In responding to that situation at that time, the government, the national task force, was thinking to distribute for free mask and face shields for sellers in mostly in traditional markets in Jakarta. So when they had this plan, the task force, I was contacted by them. That the task force has this plan, and then would you or are you interested in conducting a study, as a like not a follow-up, but also as a package of what we are going to conduct in one market in Jakarta. So I was excited. I was saying yes, this is something that we need to do as a scientist, as as scholars that trying to be part of the solution. And I was expecting that at least we can have a data, we can have information that whatever the information is, then we can also convey the information, the data to the policymakers at that time. So I said yes. And then, I prepared the study, and, because it was about distributing face masks and face shields. So, the way I construct the study is around the sellers compliant to wearing masks at that time. So this is the scheme or the structure of, what happened, what, we did at the time. There was initiative of distributing for free masks and face shields for sellers in market in Jakarta. And then, I was thinking that, we need to to have a follow-up intervention. So distribution of mask and face shield for sellers, we can see it as an intervention. It's an intervention from the government, that the government provide or facilitate sellers or people in market, to be easily wearing masks or face shield at the time. And then what we think at the time, we need to also to have a follow-up intervention to ensure that after they got for free mask and face shield, they wear it. So that's the idea of the intervention, making sure the free mask and face shield are used by those who receive this free stuff from the government. And then the idea of following up intervention is accompanied by, of course, we need to also to observe and to document or to record what really happened after the first intervention from the government and the second intervention that we designed following the government intervention. And then we design a follow-up, basically to dig into, the situation and the issues, the problem. So we design a follow-up interviews with sellers. That's how we set up the study at that time. So this is just pictures that we took at the time. We went to one market in South Jakarta, and we know that there are like different parts of the market, and basically different floors, different parts of the market can be grouped into two categories: dry areas and wet areas. Dry areas where sellers sell like toiletries, sells like cookies or anything like that, something like that. And then in wet areas is where sellers sell meats and also vegetables, and also that's how sellers categorize things or stuff in the market. That these things can only be sold in wet areas, and these stuffs can only be sold in dry areas. So that's how we try to figure out what market is at that time, consists of dry and wet areas. And because our design was a follow-up intervention, so we need to have like a baseline information, baseline data. So before we ran our intervention, we did this observation, and I forgot to mention that the government was not only distributing mask and face shield, but they also deploy volunteers for a period of 2 weeks time. So the initial step from the government was distributing face shield and mask, and then they also deploy a number of volunteers to stay in the market just to ensure that the masks and the face shields are utilized by those receive them. So we coordinated with the volunteers to conduct this observation, and then we had several meetings with them, and then we had several briefings with them how to conduct to undertake the observation and how to document or record the data during the observation. So this is the result. Sorry, Claudia, the graphs is in Indonesian language. So, but at least you can see the percentages and the bars.
I see the colors and the numbers.
Yeah, you can see colors. Yeah. First we conducted the observation in a basement that was dedicated as a wet area. There were 111 sellers. We conducted of 1 full day of observation. Especially, we observed during the peak period of people, doing selling or buying things in the market. So we can see that those who receive free masks and face shield, yes, they did wear them, the mask and face shield. But the problem is only, almost 100%, after they receive the mask and the face shield, yes, they use them. But the problem is they didn't wear the mask correctly. Like, for example, they put on the mask, but not to cover their mouth and their nose, but sometimes they put it like in their neck or just cover the mouth. Or we even observe some sellers put masks like like this. The mask is on the forehead, on their forehead. So it's funny, but it's also concerning at the time, because it's like only half of them wear the mask correctly. That's what happened in wet area. While in ground floor, dry area, the number is quite similar. The number is quite similar. It's around 50% of them, wearing the mask correctly out of the 42 sellers in dry area. Okay, so that's the baseline, the data that we got. And then, as I mentioned before, we did the follow-up intervention. The first intervention was from the government. The government provided, distributed the mask for free. So this is how we ran our intervention. So we look at because it's been quite happening. It's been like a big thing these days. I'm sure Claudia knows too about this. In the field or in the area of social intervention is using nudge theory. So basically, we were trying to use nudge theory in our intervention. So this is how we, because it was still in the midst of not midst, it was still in the pandemics. We were not really feeling safe. We went to market, and then many things considered. Then we came up with this idea of having these 3 banners. So basically, we conducted our intervention in 3 days. Like the first day, we got this first banner, and then the second day we got this banner, and then the third day we got this banner. Basically it's like replicating one of the things that have using nudge theory. Using message of norm, like 7 out of 10 sellers are wearing masks, 8 out of 10 sellers in this market wearing masks, and then the last day is 9 out of 10 sellers in this market wearing masks correctly. So that's how we structure the message, our intervention, and then in coordination with the volunteers, we place the banners in several spots in the market. And after 3 days of intervention, then we did the follow-up of interviewing on mask wearing. So we after the intervention, after the 3-day intervention, we did this interview. We selected only 9 sellers that, based on our observation, we categorized them into high compliance sellers and low compliance sellers. And we selected 5 high compliance sellers and 4 low compliance sellers. Low compliance means they didn't even wear the mask, or if they wore the mask, they didn't really wear it correctly. Sorry, Joe, I need to charge my laptop 1 second.
All right, Mas Vicky. So interesting findings, interesting intervention, yeah, that you deploy in the actual market.
Yes.
And there was a red area. Okay.
Okay. So okay, the result or the findings, basically the intervention was not that successful, but we don't feel that it was bad or something like that, because we encountered some challenges at the time. It was June, it was in the market, we were not feeling really safe, so yeah, but at least we deliver this 3-day intervention. And then we found that in wet area, less than 60% of the sellers wore masks correctly. In exact percentage is 52%. While in dry area, more than 60 sellers, so to be exact is 85% of sellers in dry area wore masks correctly. And then when we dig into the reason why they wear or not wearing masks, most of them, especially those sellers in wet area, they attributed their behavior not complying to wear a mask correctly. They attributed, or they blame, let's say, the structural features of the market building that related to air circulation. We can imagine, a basement, especially Indonesian who are attending this Zoom. We can imagine. I think we can imagine it well. The situation in a public market in Indonesia, in a building, in a basement. So, and the building was not an old building, but was not also a new building. So it's kind of yeah, it's okay. The building is okay. It's strong. It looks like not that traditional, but we can imagine the basement of the market building, and that becomes the the reason that the sellers mentioned. The air circulation is bad in the basement, and the stuff that they sell in that basement, they say that it is not very comfortable wearing masks, and they also say that it's very warm here. Basement, you can imagine, the air circulation was not as good as floors above the basement. So that's the attribution, the structural features of the market that make them not really comply to the regulation to wear the mask. And and this particular findings, we got from the interviews, right? I think this speaks to, or this can be related to Claudia's presentation. We interviewed 9 sellers, and basically all of them knows that COVID-19 is transmissible, had no medicine at the time. Yeah, right now it's also still the same situation, but we can imagine at the time, June 2020, they know that it's transmissible. There is no cure in terms of dedicated medicine, for COVID-19, and it can cause death. They know, so they realize, they perceive risk, health risk of from contracting COVID-19, and they know that, you know, based on information, based on anything that they had at the time, they know that mask had its advantage to prevent COVID-19 infection. So the question, why they didn't comply, why they didn't wear mask correctly? So this is something that we highlighted in our report. And then, you know, because our report is not just a written report, but, you know, we need to present the report to several agencies, to several state institutions. We point to these key findings of social norm, and we got these key findings, yes, based on the interview that we had with 9 of the sellers. It is very clear when they said, you know, basically, to summarize, is they say, like, you know, I wear masks is by looking at my neighbors, whether my left neighbors, my right neighbors, or front neighbors, they're also wearing masks. If they don't, I don't. That's, I think, quite an explanation. And we got these answers from 8 out of 9 interviews. Only one interviewee said that, you know, I wear mask because I want to follow the regulation, because I want to abide to the law. Only one. But 8 out of 9 interviewees admitted that, you know, their decision to wear mask is basically waiting what others do, like, you know, whether my neighbors are wearing mask or not, then I will follow them. If not, then I will not also wearing a mask. That's the I think the key findings of this intervention and these studies. So that's Joe and Claudia and all. I hope we can have a rich discussion, Q&A after my presentation. Thank you, Joe. Back to you, Joe.
All right. Thank you so much, Mas Diki, for your very, very interesting findings. Let's give a round of applause to Mas Diki, online applause, for his interesting presentation. And now I'm going to invite you to several questions, but first let me summarize what Mas Diki presented to us all. So in Indonesian context, Mas Diki is a part of a task force, for this COVID-19 prevention measures with cooperation with Indonesian governments. And then he studied about the market area in which that there are 2 levels. So there are wet areas and dry areas. The basement is the wet areas and the dry areas is in the ground floor. And apparently all of them actually wear masks, but only 50%, about 50% of them who wear the mask correctly, which we may often see in our daily life, right? Like a lot of people wear mask really in the not in the correct way, and even less who wears the face shield and both the face shield and mask. But by using the nudging intervention, in which that Mas Diki and his team employed 3 conditions of the nudging intervention. Like first is he proposed a poster in which that it said that 7 of 10 wears the mask, and after that 8 of 10, and after that 9 of 10 wear mask. And after that, there was an interview in which that the 9 sellers were asked. 5 was the high compliance seller and 4 was low compliance sellers, in which that it was found that there was a difference in the wet area and the dry area, in which that there was an increase of the they are more likely to wear masks correctly in the dry area compared to the wet area. Okay, in which that there was apparently no improvement in that, and these findings is attributed apparently to the conditions of air circulation. This is, I think, is very, very important, in which that the conditions, the perhaps the building architecture or perhaps the environmental condition is actually very, very influential for us in order to do some COVID-19 prevention measures. And maybe we should examine this more deeply. And this is something that I think is very, very important for us to understand. And also, he found that social norms are important, and so a lot of people wear masks correctly because a lot of people that they know in their daily life, in their other neighbors actually wear it too. But if it's just merely rules or regulations or laws, it's not really effective. But it should be shaped as a norm. Okay, so very, very interesting. So I'm going to invite 3 questions first for Mas Diki. Is there anybody who would like to ask questions to Mas Diki?
Can I ask the first one?
Sure.
I respect. Okay. Ya, tuh Mas Diki.
Hai Mas Tito.
Baik, apa kabar? Mas,
baik.
Mas Diki, my question is, your study took place in June of 2020, right? Which is, I think at that time it was really a very critical time, but I think we experienced the first and second wave afterwards.
Yeah.
So the first wave was in the end of beginning of 21, and the second wave, the bigger wave, was in last June and July, I think. Being part of the task force, I'm also part of the team from Prof. Wiku. We noticed that there has been a significant change in behavior, I think, Pak Diki, of the general population, let's say. Do you find also that? Do you agree with that, or have you conducted something of a similar nature to measure because I think the behavior at that time and the behavior immediately after the second wave, which was around July, early August, I think, or we perceive that to be very, very different, significantly different. People were more willing to comply because of examples of so many deaths and so many, incidents, severity, and so on. What is your opinion on that? Because I think the Satgas, the task force, place a great importance on behavior change. They have one big division specifically for behavior change, and I think that was the division that asked you to provide inputs, Mas Diki. So what is your take on the situation at the moment with regards to behavior change in the general population?
Yes, thank you, Mas Tito, for your questions. This is very important questions, and because I think throughout the pandemics, it's like a dynamic situation. Basically, it's not a static. It's from the time to time it changes, and it is sometimes the changes happen quite drastic and rapidly. Based on the study that I conducted at that time and the way we convey the message based on the study, we were very, very trying to be very careful, because the study was conducted in a specific context of market, and as you can see in my presentation, they refer the structural features of the market. It's a closed space, limited air circulation, something like that. So the way we we analyze and we convey message based on the study, we do not want to to predict or to analyze all types of behavior, in the market and also outside the markets. But at least from the study that I conducted at the time, it is very clear that it's about behavior, and there are factors to behaviors that we need to take into account. And in my study, it is very clear that we need to take into account the structural features of certain types of buildings, certain types of location. Mm-hmm. And also from the study it was quite clear, the message that it's a social norm, that if we want to influence, or if we want to make people change, we can change them, not directly ask them to change, but others to change. That's I think the main takeaway of the study. Yes, it is behavior, and I think it's still up to today. It's about behaviors. The whole situation of whether the pandemics gets worse or gets better, it's about our behaviors. And I think we need to map out and to identify in certain locations, certain contexts, certain cultural, political situation, what are the factors that influence people's behavior. That's, I think, the something that I can respond to Mas Tito's comment and also questions. Thank you, Mas Tito. Yeah, and I think Mas Effendi wrote about role model. I agree with you, Mas Effendi, about role model, the role of role model.
Okay.
Or someone we look up to. Yeah.
Mm-hmm. Right. Thank you. Okay. We have second question, Mas Diki, by Pak Ibnu, ya.
Yeah.
Okay, Pak Ibnu, silakan.
Thank you. Thanks, Juvarian. And Mas Diki, how are you today?
I'm good, thank you, Mas Effendi. How are you, Mas Effendi?
Good, thank you. I have a point which is try to take it to the next level, this discussion, and I would like Mas Diki and Dr. Claudia as well, Dr. Diki as well, to comment later on. This is about the subject of sustainability. The three pillars of sustainability is actually environment, economy, and society, right? Now, all this that we discussed this afternoon actually related to that. In fact, let's say pandemic is over, let's say in a few months or perhaps a year or two. Let's say COVID or Omicron become endemic. So we live with this. We live with that, all of us now. But what about the future? Something preventive, something preventions. How do we actually look into the environment so that and society so that this thing will not happen again? I need your view on this one. Mungkin general view, Dr. Diki and Dr. Claudia. Thank you.
Yes, thank you, Mas Effendi. This is important questions, but also I think the answer is very difficult to give, especially the right answers. I agree with you because I read a book entitled Third Pillars. I don't know whether any of you has read the book entitled Third Pillars. And the book exactly mentioned quite similar what you said about three pillars of environment, economy, and society. But in the book, it mentions a state or government, and then the second one is market, business, and the third one is community, people. And I agree with you that, if we talk about the pandemic, I think this is not going to be the last pandemic that we ever experience. I think we will face another pandemics. And if from the history teaches us the previous pandemic, the bad pandemic occurred 100 years ago, the Spanish flu, maybe it will happen in the future. We don't need to wait until 100 years, maybe in 10 years time, 20 years time, we will face another pandemics. I think, I strongly believe that the pandemics caused by, the way we live our lives, and I think it's something about, you mentioned about environment, how we interact with our environment, because, virus is an organic, thing. It's organism. So it is created by something happened, also, from the organic mechanism, things like that. So I believe that this is not going to be the last pandemic, and we will face another pandemic, and maybe in a less time than 100 years. So yes, it's about our behavior that creates or instigate the pandemic, our behavior that worsen the pandemic, our behavior that prolong the pandemic, with the Omicron, the variants and all of that, the way we, distribute vaccines that creates vaccine inequity, unequal distribution of vaccines. That's, something that we create. So it's our behaviors. So I think, we need to be mindful that, this pandemic is not coming from the gods. It's us who creates this pandemic, and it's us who can manage or tackle this pandemic. Maybe that's what I can respond to Mas Effendi questions. Sorry, maybe if that's too abstract or not so spot on.
I can say a little bit quickly about that. First, Dickie is absolutely right. It's not an easy question to answer. Let me just say first something about your presentation, then I go to your question. It is so hard to get effects on field interventions. Usually we have a lot of effort, and it just, so, we still don't know very well how to do this, actually promote behavioral changes. And if you go to natural context, it's even worse, because there's always something that doesn't work. And, going back to some questions that I had about how people think about the virus or education or information, let us say what we know to date is that these things matter much less than you think. One of the most reliable predictors of behavioral change is social norms, and that is across all contexts, okay? That is health, that is education, that is sustainability. Don't worry about, people should be educated, people should be informed, that's for sure. But don't think that is going to promote the behavioral changes you think it will, because usually it does not, okay? But whether you say that people don't want to feel bad or don't want to feel ashamed because everybody else is doing the same, that is a very strong predictor of change, okay? And that is really a strong message, okay? So don't think, don't worry so much about whether people are super informed about the virus. If the neighbor is wearing the mask, they will use the mask. And then about the question made now, what I can tell you with that, actually the second paper that I'm writing now about this collaboration that we have sort of focuses on this. I try to include some items to try to see if people's views on the environment and other things had changed. So it's still in the goings. What I can tell you is that it doesn't seem to look good. It doesn't seem to be good news, because the economy in so many countries was hurt. People really are caring less about the environment now. So they want to put the economy back on track. That is a problem. So actually, the issue of climate change, it can actually get worse now in the years post-pandemic, because people, really care about the economy, getting the economy back on track. And it seems to notice is that, so going back to this notion of health risk and economic risk. So economic risk seems to be driving people's views on political issues a bit more towards, let's say socialism, on lack of a better word, meaning like, it seems like the people who suffered this economic risk more are more willing to support things, let's say, as universal healthcare. Okay. The only good thing about this health risk, so people who perceive a very strong health risk, a very strong risk of getting the virus, seem to become a bit more pro-environmental, but just a little bit. So we still don't know. So the views on the views on environmental attitudes actually got a little bit worse due to the pandemic. And the ones that got a bit better was the ones who got really scared of getting the virus, maybe because they realized the virus came from, animals and all the bad stuff we do to the environment. So maybe in a couple of months I can say more, but as of now, that's all I can say.
Okay, thank you for your answer, Dr. Diki and Dr. Claudia. Okay, so Pak Effendi, I'm sorry, I did not realize your real name was Pak Effendi. I called you Pak Ibnu. Yeah. Okay, so you ask again that, so the biggest enemy is poverty. Would you mind to elaborate on that?
No, I mean, discussing this for a couple of hours, economic, I like the subject called behavioral economics. And I think economics tends to influence a lot of things in behaviors. So I was saying that perhaps the biggest enemy is poverty. So that one we have to attack. And then if people are not, they have enough, or say, let's say they can live decently, then perhaps all the other things, the problem will go away. Things like that. I don't know, Dr. Juvarian.
Okay, yeah. I think we agree that we should fight poverty. I think everyone should agree on that. We should fight poverty. Okay, we have thank you, Pak Effendi. We have another question from Daniel. Maybe this is the last question that we are going to address. Thank you for your presentation, Dr. Diki. If I can have a question, your findings point out that regulations by government apparently did not have that effective impact on COVID prevention behaviors compared to social norms. Do you have an opinion on how and who could make this social norm is accepted by society? That's an interesting question.
Yeah. Thank you, Daniel, for your questions. I think the result of my study, it sends a message that actually government could also do something, like they could create, they could design, they could condition into the society. So the point is not to directly like going to individuals' behavior, and the aim is to change individuals' behavior, but the aim is how to make individuals realize the presence of others, or then the way others are behaving. So I think the essence is that social norm can also be induced by many ways that government can do with their resources. Like, for example, I think last year, started last year, we have this public service campaign, ingat pesan ibu, remember your mom, right? So it's the way that we change our behavior, not because of we wanted to change it, but because we think about others. I think social norms is about the way we think about others, and then we follow what others do or what others think. And then, if others comply wearing mask, then I can also comply wearing a mask. So I think that's something that I can take from the study that we conducted last year, that it's the government still can do something, like creating condition or conditioning people to think about others instead of to think about themselves when they think about should I change, should I follow this or that, or should I do something. So that's something what I can say. Thank you, Daniel, anyway, for your questions.
Okay, so thank you for that last question. Yeah, I think that concludes our meeting for today. That is definitely a perfect way to end our discussion. And I'm gonna right now, before we close our event for today, I want to announce the winners of the today's 3 best questions. Okay, but first I want to say to Angelia Putri Aisyah, you attended the first online webinar last month, and you have won. Actually, you have won as the best question. So today we will give the prize to the other people. Okay, so right, so the first one who got the prize is Pak Daniel Ariwibowo. Congratulations. Let's give a round of applause to Pak Daniel Ariwibowo. Okay, and the second one is Pak Effendi, Pak Muhammad Ibnu. Congratulations, Pak Muhammad Ibnu. And the third one is Pak Wahyu Indrasto. Okay, congratulations for the 3 of you. Okay, the prize will be sent to you by the Secretariat of the Master Program of the Faculty of Psychology, Universitas Indonesia. And we have also recorded your email when you register, so we will contact you via email after this. Okay, that also goes for the winner for the last events. Okay, for the event in the last month. Okay, so again, thank you very much for Claudia and Mas Diki for your insightful and interesting presentation. I'm sure this is really the take-home message is really useful for us in order to understand more about the COVID-19 prevention measures. And let's hope that we can spread this knowledge about that was we experienced today. And also thank you for the head of the master program, Dr. Rizka Halida, for holding this event in the first place, and also for all of the committees, Mbak Eka, Mbak Rani, Mbak Wahyu, Mas Imran, and Mbak Medi. Okay, and also thank you for all of the audience who attend today's event. So let's meet again in the next event. And so thank you for all, and stay safe, and thank you.
Thanks.
Bye.
Thank you. Bye. Stay healthy. Stay safe, everyone.
Stay healthy. Take care. Bye.
Thank you, everyone. Thank you, Claudia, Mas Diki.
Thanks, Claudia. Thanks, Diki.
Sama-sama. Terima kasih semua.
Terima kasih semuanya. Ya, thank you Dr. Diki.
Terima kasih, Pak.
Thank you Dr. Diki.
Terima kasih semua.